Welcome to this edition of Pulse on Health. I'm your host, Mark LeMay. As we get into the depths of winter and have started a new year, winter ailments manage to crop up. Combine that with the ongoing COVID situation, and we have ourselves a packed program. Joining us on this edition of Pulse on Health is Dr. Tuhin Roy, fourth-year resident in the Lawrence Family Medicine Residency Program based at Greater Lawrence Family Health Center. Welcome to the program, Doc.
Hi, thank you, Mark, for having me.
So first things first, let's start off with the common cold. What is a cold, and is there a cure for the common cold?
So, Mark, that's a great question, and I would say that's actually a very common question that we get in the winter. We've heard a lot about viruses lately. I'm sure everyone is well aware of the coronavirus. The common cold is yet another type of virus. There are hundreds and thousands of viruses out there, and some of them can cause us to be a little bit sick. And so the common cold is actually any one of these viruses that can cause a runny nose, a little bit of a cough, or the sniffles. Some of them can be more dangerous, and that's when we get things that are like the coronavirus that become much more dangerous than the common cold. A cure is actually a really good question, and I would also say that's probably one of the questions I answer the most over the winter time. Unfortunately, there's no cure per se. There isn't like an antibiotic or a medicine that takes and makes a cold completely go away. Our bodies are remarkably well at managing common colds. And so really what we try to focus on is giving us the tools we need. The best thing to do is lots of rest and lots of hydration. If you have fevers, you can take medicines like Tylenol or ibuprofen, whatever that, if your doctor says that's okay. And one thing that actually helps a lot of people when they have sore throat or just feeling kind of crummy inside is hot lemon tea with honey. Interestingly, there's lots and lots of things out there on the shelves, lots of medicines that you'll see on the aisles. But that's the one thing that's been studied to actually make things a little bit shorter and make people feel a little bit better.
Okay.
So, yeah, nothing too special.
So there's no medicine. All the medicines that are out there that are cold medicines are simply to take the edge off, I guess.
Yeah, exactly. A lot of the cold medicines that are out there have different formulations of either acetaminophen or Tylenol and ibuprofen. Oftentimes they'll have something in there to make you a little sleepy so you can just sleep through the night. But yeah, basically it's just there to take the edge off.
So how is the cold spread from person to person?
So this is actually something I feel a lot of people might be very familiar with now in the last year. It's spread just by droplets in the air from your mouth. So sneezing, coughing, sneezing into your hands, touching a door handle, somebody else touching it, being in the same room as somebody who has a cold. The same things that we've kind of heard about in the last year with coronavirus. Different colds are different. And so I think I have had patients ask me, so how come I don't get a cold that often, but we're all scared about the coronavirus? And that's also a good question. They're spread in a similar way, but it's sort of how infectious it is. And sometimes, if you're going on in life, you've had a couple colds in your life, your body might be pretty good at handling it and you just don't get any of the effects. But sometimes, you might not have seen that particular cold before and you can get a little sick. So it's, nothing too special, just stuff that we've been hearing for the last couple of years.
Well, when we talk winter, typically we talk flu. But there's been some research that shows that this year the prevalence of flu is lower, possibly due to the lockdowns and mask wearing as a result of COVID-19. What is the flu and and how does it differ from a cold?
Yeah. And Mark, that actually is such a good question because it really points out exactly what I was saying. Flu, cold, any of these things are spread sort of the same way. And good old fashioned hand washing, staying away from others when you're sick, wearing a mask when you're sick can really make a difference. And so we've seen that with the flu. The flu itself, a simple way to put that is we're looking at viruses, cold, coronavirus, flu. They're all a type of bug called a virus. Some of them are more severe than others, and flu is a specific type of severe virus. People get similar symptoms often to a cold, but often people get more severe symptoms. So they could be sicker for longer, or they can get really sick and require being in the hospital for that.
And some of the flu symptoms are muscle aches and talk about some of the other symptoms that I might be missing when it comes to the flu versus the common cold.
Yeah, so oftentimes they might start the same way with the runny nose, little cough, feeling tired. Flu often is associated with muscle aches, and it can be very, very fatiguing. People can feel very tired from that. The flu, unfortunately, is pretty severe as a virus, and it can cause a lot of damage to the lungs as well. People that are younger sometimes can get away just fine, but it can be pretty dangerous to really young people and as well as very old people who might not have enough ability to fight them off in the lungs. So oftentimes they might start the same, but if you have those high fevers, just feel like a truck ran over you, are not really able to breathe really well, that's probably a flu or something more severe.
I know the health center and doctors like yourself start promoting getting the flu vaccine in September, depending on the age and your predisposition. Um, we're now mid-February, early March. Is it too late to get a flu shot at this point?
Good question. So not at all. So we, and by we I mean just health professionals everywhere, including the CDC, recommend getting the flu shot at any point during the whole flu season. Our flu season, oftentimes here in New England, with the cold weather and the dry air, can go well into April. So this is a prime time to get it. A flu vaccine gives you the tools, gives your body the tools to help fight against the flu. And I'll kind of go off of that question a little bit, Mark, because I know one thing that people ask me a lot is, well, how come if I get the flu vaccine, I still get sick? And it's a perfect question actually, and it's often hard to answer, but I think we're seeing more and more of that, especially with talking about the COVID vaccine. The flu vaccine gives your body sort of a message and gives it the tools to know what the flu looks like this year. But that being said, like I said, the flu is a pretty nasty virus and it can still get into your system and still kind of wreak havoc. However, your body, after getting the flu vaccine, is better prepared to fight against it. And some people might get sick if they get the flu, but they're less sick than before, than if they had not gotten the vaccine. And the studies, and we know it prevents and decreases admissions to the hospital and admissions to the intensive care unit, which are both things that we want to avoid in everybody.
So you mentioned hospitalization when it comes to the flu. When should someone head to the hospital? And again, I put the asterisk on that question because we're in the COVID situation right now. But in a typical year, because 2020, 2021 is not a typical year. In a typical year, when would somebody say, hey, I should go to the emergency room?
Yeah. Yeah, nothing typical about this past year. So it depends on how comfortable somebody feels. If you're at home, if you're taking acetaminophen, ibuprofen, drinking lots of fluids, having your honey lemon tea, resting, and you don't feel great, but you can still get by your day, probably good to stay home. But the serious cases of flu can cause people to have what we call respiratory distress. So having difficulty breathing, breathing very fast, or have feeling confused and just not being able to kind of get a sense of where they are, those cases are pretty severe, and I would recommend going to the hospital for further evaluation. Of course, if anybody has any questions, it's always good to give your doctor a call or ask to be seen, and they can help evaluate you as well.
Our guest is Dr. Tuhin Roy, fourth-year resident at the Lawrence Family Medicine Residency. Uh, Doc, with winter comes snow. With snow becomes shoveling. With shoveling comes aches and pains. And with the last couple of snowstorms, I've been feeling those aches and pains. How can someone lessen those pains?
Good question, and timely since we're getting so much snow now, a little bit late in the year. Um, Good question. So, aches and pains are often your muscles telling you that they're being stretched out, they're being strained some more than they usually are. Shoveling oftentimes for people is a pretty hefty workout, actually. Ways to help kind of lessen those aches and pains before shoveling, I would really recommend going slowly. Don't try to overexert yourself. Think about it. It's like as if you just were a casual walker and then try to run a marathon the next day. Your body's going to have some discomfort with that. So going slowly and making sure you're stretching in the middle, taking breaks as you need it. Of course, if you have any discomfort at all while shoveling snow, definitely stop and let somebody know. Um, Interestingly, snowstorms are also when we see the worst heart attacks as well because of this reason. Everyone starts using their muscles suddenly and it becomes harder. After shoveling, though, is take a break, take it easy. Think about it. You just did a big workout, and congratulate yourself for that. And take it easy. Resting, lots of fluids help. Dehydration can make muscle aches and pains worse. So staying well hydrated is super helpful as well. And if you need, you can also take an anti-inflammatory medication like acetaminophen or ibuprofen if your doctor allows. Those medications can help sort of decrease some of those aches and pains. And hopefully the next snowstorm will be a little bit stronger, a little bit more well-toned, and will be a little bit less than before.
Our guest in this edition of Pulse on Health, Dr. Tuhin Roy, fourth-year resident at the Lawrence Family Medicine Residency, which is part of Greater Lawrence Family Health Center. We're going to come back. We're going to keep on the muscle discussion and New Year's resolutions and getting in shape and what to do when you pull a muscle. That's coming up next here on Pulse on Health. And welcome back to Pulse on Health. I'm your host, Mark LeMay. This week, it's our Ask a Doc segment. And the doc, Dr. Tuhin Roy, fourth-year resident at Lawrence Family Medicine Residency at Greater Lawrence Family Health Center. Doc, with the new year, many people decide to make those dreaded New Year's resolutions to get into shape. Chances are pretty good that if you have to get into shape, you haven't exercised in a while. Let's talk about some simple exercises that people can do, especially during a pandemic.
Thanks, Mark. Yeah, I might say I might be in that same boat as well, actually. So it's okay. Um, I think the first thing to keep in mind is take it easy on yourself. You're not going to go from walking to running a marathon the next day, and that's okay. A lot of times people feel the injuries people get are when they go from 0 to 60 very quickly. Simple exercises are a great way to start. And the pandemic, even though it's taken away some of those gyms and other places that we work out, it hasn't taken away our own homes and the outdoors. While it is kind of cold out now, on other days, just going for a simple brisk walk outside with a mask, of course, is a great way to start getting some exercise. We know that if just getting fresh air, some sunlight, and moving your muscles, moving around and getting your heart pumping is a great way to start exercise. And that in itself is a good way to on the road for good health. Other exercises you can do, especially in the winter time when it's cold and maybe walking outside for half an hour seems a little bit not what you want to do. is just staying at home and doing exercises at home. There's COVID has actually helped produce a lot of great exercise videos online. You can find them anywhere, just Googling anything. There's great videos that are 3 minutes, 5 minutes, 7 minutes, very short and easy to do. And the cool thing about these videos or anything that you might look up is that you don't need anything special, no special equipment. You can do body weight exercises. If you Google them, you can find them. Basically, exercises where you use your own body weight, push ups, sit ups, things like that,
Hmm.
that you don't need anything special and they really still create a workout for yourself. You can also use things in your house that's laying around and cans, water bottles, things that have light weights. Even repetitive exercises with light weights is a great way to start doing some exercise. So while the idea of doing a lot of exercise could be daunting, just simple starts, even at home, and adding in some walking and some other light exercise can really put you on the right track.
Last week, walking through a parking lot, and I hit a patch of ice. I pulled my calf muscle. And again, I'm not a doctor, so I could have pulled any sort of muscle. I don't know. It hurt. Clear up a misconception for me. Immediately after, do you heat or ice the area? Do you do anything? Or do you just let Mother Nature take its course?
So that's a good question. I think a little bit of everything.
Okay.
At the end of the day, Mother Nature is going to take its course. And the most common way of dealing with a muscle pull or strain is resting and letting your body heal on its own. Ice can be very helpful right after something happens. When you pull or strain a muscle, essentially what you're doing is you're stretching it out further than it usually goes, and suddenly it's going to get very inflamed. Ice helps bring that inflammation down and can often help bring that pain down as well. Some people, though, also what you can do is using heat to warm up your muscle. If you know you've strained your muscle, but then you need to go for a long walk or lift heavy things, you can use heat to help relax the muscle, bring some blood flow so that it doesn't feel as stressed the next time around when you're going out there. But right when something happens, let's say you slip and you're noticing some swelling, ice is very helpful for that. But
Okay.
overall, Mother Nature will take its course and just time can help the best. Of course, if you've got worsening pain, feel like you can't walk at all, numbness or tingling or anything that worries you, definitely seek out your doctor. But a lot of these times, just a little bit rest and ice at home can be helpful.
I want to take a minute to talk about COVID. Not the treatment, not cures, but the emotional aspect. You and your fellow residents were and are on the front lines at Lawrence General, treating COVID patients. How are you guys doing?
That is a tough question, Mark. Um, I will say the last year has probably been the hardest in my medical training, and I know it's just the beginning, so there's that. But it's definitely been one of the hardest in my life, actually. Treating COVID is emotionally exhausting. Um, there was a huge surge and a lot of patients with COVID. And I know we see it in the news and we see it on the social media, but seeing it every day for a lot of our residents and myself was extremely difficult. There were lots of difficult conversations with families. And the hardest part of it was that families couldn't come to see patients that were in the hospital. And so many of us residents, other doctors, the nurses especially, kind of became surrogate families to a lot of our patients that were there. And that is emotionally draining and difficult. So how are we doing? That's a tough question. I think it was a very tough road, and all of us are very optimistic that we are coming out of it. Having the vaccine out there, having lower numbers, seeing the hospital just being able to breathe, these are all optimistic signs. for us. And I think just that optimism is helping us get through a lot. Um, Go ahead.
Well, I mean, residency has its tough times as it is. Um, Lawrence has a 4-year residency program where traditionally there's a 3-year program. So it adds another year of being a resident. Um, but I suspect the COVID situation on a resident perspective isn't just physical, it's emotional. It's a combination of both because I'm sure there were many long nights for you and your fellow residents. Um, so you sort of got the double whammy there with the physical and the emotional.
Yes, definitely. Um, yeah, the long hours I think can drain anybody out. But like I mentioned, there was a very high degree of emotional investment by all of our residents. I'm very proud of our residents and our residency. Um, our residents were the main physicians taking care of the Lawrence General Hospital COVID unit, and we saw the vast majority of patients that were with COVID at Lawrence General Hospital. And you're right, residency is long, and we are often prepared and prepped to have difficult conversations. And many of us go into this to have connections with patients and especially patient families. But having a difficult conversation every hour of every shift, having conversations with families that can't see their patients, having patients that you were able to have conversations that no longer are able to speak to you and are declining. Those are definitely emotional hits that I don't think any of us were prepared for. And honestly, I don't think I still am prepared for. It is a lot of emotional reserve that it took. And so you're right. I think with the emotional and the physical aspect, it was draining and tiring.
I mean, we're a family medicine residency, which means we see people from birth till geriatric, and that's hard enough. I'm pretty sure none of you signed up for because again, a family medicine doctor, a family medicine resident is a special breed, especially in Lawrence. You have the cultural issues, you have different backgrounds, but I don't think any of you signed up for the COVID situation.
Yeah, correct. Family medicine, like you mentioned, is often said it's the cradle to the grave. So from start to beginning. And I know for us at least, everybody who's here at Lawrence loves that. But everybody here at Lawrence also loves the community and is here because of family medicine, just encompassing everything else that's in medicine, the family, the community, all the social aspects. All of those together sort of come to a head at once, especially with this COVID pandemic. And yeah, that was difficult. And I think it wasn't quite what anybody signed up for in residency, um, but it's definitely something that everybody was able to take in stride. And I think be very strong doctors during, because, like you said, family medicine prepares you well for many things in life.
So residency is a difficult time anyway, aside from COVID. Let's ignore COVID for a minute. Well, up to COVID, what was the hardest part of residency for you?
It's funny to think about because I feel like I don't remember pre-COVID. What was life then? Life like that. Um, Residency. So for many people, let me explain what residency is. I think that might be helpful. So to be a physician, you go to medical school for 4 years. That's after college, and then after medical school, you are essentially in what's basically an apprenticeship. So you're in residency. You're a full-fledged doctor. You're able to practice and prescribe and see patients on your own, but you still get training and you're still under supervision and growing and training in your skills. And like you mentioned, Mark, most family medicine residencies are 3 years. We have 4 years of training here in Lawrence because of the incredible opportunities here. But after residency, then you become what we call an attending physician. So you're there, you're on your own, you're making decisions on your own, and your buck stops with you. This transition, I would say, from being a student, learning about medicine, knowing theories, to seeing the patient in front of you and being the end all to make that decision, it is intense, like you mentioned. I think the hardest part of residency for me was that transition in the middle of residency where I felt like I knew what to do and I knew patients and I knew the medical knowledge, but then I had to make the decisions and I had to see what would happen and answer for my decisions. And of course, in residency, there's always somebody supervising us. But that transition, we call that often, so the first year of residency is intern year. So that transition from intern year to second year, where suddenly your decisions become your decisions, is definitely the most difficult part, at least for me. COVID aside, I think COVID wins the vote for all of this
Right,
stuff.
right.
But there's an immense amount of growth that happens in residency. And of course, I can only say so much having not finished it yet. But that trajectory is pretty cool, but it's hard to fathom sometimes.
Real quick, we're short on time. You graduate this summer. Any plans for the future at this point?
Good question, Mark. I'm still trying to figure that out fully. I graduate this summer from Lawrence Family Medicine residency, and I hope to continue practicing full spectrum family medicine. I hope to also continue doing academic work in medicine and teaching. And so looking around to see where I end up.
All right. Well, thanks for hanging out with us for 4 years.
Thank you.
And thanks for joining us here on Pulse on Health. Until next time, have a great week.